Next thing we're going to move on to is going to be the Kybella. As you can see, I'm going to have you look up just a little bit for me. What we do is we place a grid, and this helps to assure that we are placing the product in an even distribution in that submental area. Okay, you can relax. Okay. Now, the way that you choose how many vials that you want to use really depends largely on the surface area. So men, they naturally have a larger surface area, so they're going to require a larger volume. The average amount of Kybella to use is usually 2 to 3 vials over the course of 2 to 3 treatments. So we're going to start with 3 vials in her case. We'll have her come back in about 6 to 8 weeks, reassess, and then probably add another 2 vials. And that's pretty much the standard for most women. All right, 1, 2, 3, stick. We're placing 0.2 units in each injection site. Now, even though we do place numbing cream on this area as well, the way that this product works is with, like I mentioned before, the deoxycholic acid targeting those fat cells. Therefore, it will start to burn, and you just want to explain to the patient that that's normal, and it's an important part of that chemical reaction in destroying those fat cells. And you can see it's not a very deep area. You really don't have to bury the needle too much. This will form an inflammatory response that will result in a skin tightening effect as well to really improve that jawline and chin profile. And just like anywhere, if you do come across a slight little bleeder, you want to hold pressure there. That'll minimize bruising. And like I mentioned before, the effects of Kybella are permanent. Once this fat is gone, just like in liposuction, it doesn't come back. It's a really good alternative to liposuction, especially in these small areas, as opposed to, people that would prefer to stay out of the operating room. There's really little to no downtime with this procedure other than some mild bruising and soreness for a couple of days to follow. Usually I like to just kind of check in with my patients around week 2. Usually around that time, that's when all these products have settled in and we get the results that we want. That's a good time to have people come back just to assess for any touch-ups, make any adjustments. Last little bit. And there you go. All right. And that is a demonstration of injection with Voluma, Juvederm, and Kybella. Thanks for watching.